Hello everyone. My name is Dr. Zhou Jingyi. Many of you probably consciously eat vegetables, fruits, brown rice, and other healthy whole foods every day for your long-term health. It is a fundamental piece of medical knowledge that we all believe. If you eat a healthy diet, your risk of disease will decrease. This is the foundation of modern wellness. However, a surprising research finding has recently been published that shakes this common knowledge. It suggests that for some, the rules might be changing in an unexpected way. The study indicates that the more fruits, vegetables, and whole grains a person consumes, the higher their risk of developing early-onset lung cancer under the age of 50 may be. What is happening to young people who don't smoke and are mindful of healthy eating? Why are the most health-conscious individuals appearing in these specific cancer statistics? Today, based on the latest data presented at the American Association for Cancer Research in April 2026, we will explain the real cause behind this shocking news. We will break this down in an easy-to-understand way without using any technical jargon, helping you understand what we should do starting tomorrow for our safety. First, let's take a precise look at the research data that formed the basis of this information. This announcement was made by a specialized team of researchers at USC. The research team was led by Dr. Jorge Nieva. They conducted a detailed investigation into the dietary habits of 187 non-smokers who were diagnosed with lung cancer. All of these individuals were under the age of 50. This early-onset lung cancer is a specific area of concern, especially since none of these patients had a history of smoking. The index used here is called the Healthy Eating Index, or HEI. This is a system established by the US government to score how healthy a person's diet is. The average score for a typical American adult is 57 points. So what do you think the scores of these young non-smokers who developed lung cancer were? Was it lower? No. The results were the exact opposite. Their average score was 65 points. In other words, they were clearly eating a high-quality, healthy diet compared to the general population. Let's look at the specific numbers. While the general adult averaged 3.6 servings of green and yellow vegetables per day, the patient group averaged 4.3 servings. For whole grains like brown rice and whole wheat, the general adult averaged 2.6 servings, while the patient group averaged 3.9. They were doing everything right. The data also showed that this early-onset lung cancer was more common in women than men, and women on average consumed more vegetables and fruits than men. Why were young women who ate a lot of vegetables at increased risk? This is the paradox that has surprised medical professionals worldwide. Let's dig deeper into the why. If eating vegetables and fruits causes cancer, I don't know what to believe anymore. If the healthiest choices are the ones hurting us, where does that leave our health? There is no need to despair. Dr. Nieva clearly states, the problem isn't the nutrition of the vegetables, fruits, or whole grains themselves. The vitamins are still good. So, what is the cause? The research team considers the most likely culprit to be environmental pollutants, such as pesticide residues and herbicides. Trace amounts of pesticides inevitably remain on the outer layers of commercially mass-produced vegetables, fruits, and whole grains. They stay on the surface. In fact, these natural whole foods tend to retain pesticides more easily on their surfaces than meat, dairy products, or even highly processed foods. Because we are encouraged to eat the skin of fruits and the husks of grains for fiber, we may be inadvertently increasing our exposure to these surface pollutants. The medical community has long known that people exposed to large amounts of pesticides in their work, like farmers, have a higher risk of lung cancer. The research team hypothesized that the same phenomenon might be occurring at our dinner tables. Those who eat more produce might be getting higher cumulative doses. Young women who diligently ate large quantities of vegetables daily for their health may have unknowingly ingested more trace amounts of pesticides than others. The essence of this news is not that vegetables are bad, but rather a warning about a new environmental problem: pollutants hidden behind high-quality food. Let's touch on another point: why younger generations' lungs are being targeted. Lung cancer before age 50 differs significantly from smoking-related cancer. It's important to understand the medical difference between cancer development and cancer progression. One is the start, the other is the growth phase. Normally, antioxidants like vitamins found abundantly in fruits and vegetables are our guardians, protecting cells from damage and blocking cancer's start. However, what if a tiny, invisible cancer seed already exists in the body, born from a genetic error? These cells are incredibly tough and adept at absorbing energy. Imagine a factory's security system. The guards are designed to protect the factory from external threats. But if a spy has already infiltrated the system might mistakenly protect the spy as an insider to be protected, creating an environment where the spy could thrive and multiply undetected. In other words, cancer cells might use the high nutritional value of vegetables as a shield, making them more likely to survive. This is a potential biological mechanism. Specific mutations common in non-smokers, like EGFR, might interact with these nutrients differently than healthy cells. Research into this is ongoing. So, based on what we've discussed, how should we change our diet starting tomorrow? If you're thinking, I'll stop eating salads, please absolutely do not do that. Stopping the consumption of vegetables and fruits is far more dangerous for your body. The lack of fiber and vitamins would lead to much higher systemic risks. A vast number of studies have proven that vegetables and whole grains reduce the risk of many diseases, including heart disease, stroke, diabetes, and colon cancer. It's important to remember that individual results vary due to genetics and gut microbiota. Don't throw away these significant health benefits for your entire system. What we should do is manage the risks effectively and eat them safely. Here are 3 concrete measures you can start implementing today. First, wash thoroughly. Most residual pesticides on the surface can be significantly removed by washing under running water or soaking for about a minute. Second, peel if you are concerned. Even for fruits like apples and cucumbers, peeling can further reduce the intake of surface contaminants. Third, choose organic produce where possible. Choosing pesticide-free or organically grown produce, even if only for your most frequent items, is a wise choice. Remember, the goal is not to eliminate these healthy foods, but to minimize the cumulative load of environmental factors that could impact your cellular health over time. By making these small adjustments to your daily routine, you can continue to enjoy the protective benefits of plant-based nutrition while significantly reducing potential risks. This proactive approach to your diet, combined with being aware of the latest medical research, is your best defense in maintaining a truly healthy lifestyle in our modern world. This study from USC is a preliminary announcement, indicating only a tendency observed. It does not prove a causal relationship between eating vegetables and cancer. The research team plans to further examine patients' blood and other samples to determine if pesticides are truly the cause behind this observed correlation. Medical news sometimes uses extreme headlines to shock us. The important thing is not to panic, but to correctly understand the content and nuances of the information. There is no magic food that is perfectly clean. The best practice is to wash thoroughly and eat a balanced diet with a variety of whole foods. Variety is key. And even for younger generations, if you experience discomfort, like a persistent cough, don't ignore it. Prioritize regular health checkups and visits to medical institutions. With the right knowledge, enjoy delicious and healthy meals today. If you found this helpful, please subscribe and give it a thumbs up. Thank you for watching. I am Dr. Zhou Jingyi, and I hope this information empowers you to make informed decisions about your health. Stay curious, stay healthy, and I will see you in the next video.